So our topic today for Wellness Wednesday are Zyns. You hear all about them. People, especially younger people, are using them. But the easy question, are they safe?
Well, you know what? Right now, I'm having a lot of discussions with a lot of my patients about Zen. Zen is heavily marketed on the internet, especially on social media. It looks cool to the young people, but what's showing is some people are losing weight on this medication. It's not a medication, I'm sorry, this product. It's a over-the-counter nicotine pouch. And what's happening is some people are losing weight with it, and a lot of people are coming in saying, should I take it, Dr. Quinn? And what I'm telling them is right now, the research is not there. It's not proven to be safe yet. And I'm not recommending it because if they use the nicotine, it is associated with elevated blood pressure, elevated heart rate, and it can be dangerous.
And how different is it than just regular chewing tobacco? It's kind of used in the same form. I assume they're different.
Right. It doesn't contain the nicotine tobacco leaves that's in chewing tobacco, but it has nicotine synthetic powder that's in a little pouch. And you put it in the gum of your mouth, and it's absorbed into your bloodstream, and you get a rush of nicotine. And the way people are losing weight with it is it causes an increase in leptin. That's a hormone in your blood that causes you to get full quicker. But what also happens is the nicotine can cause a dopamine rush, and you get like a feeling of pleasure. But it only lasts so long. Some people are reporting irritability and anxiety when they don't get it again, and that makes us worry about addiction.
Forget weight loss for a second. Younger kids are using this. We know that tobacco is not safe for young kids. Is this the same for Zyns?
Most definitely, because as I said before, the addiction concerns in the medical community are more concerning with young people that have never smoked. Because if they start using Zen to try to lose weight, then there's a chance they could become addicted to the nicotine, and then they might start smoking. And that's something we want to avoid. So the message that we want to convey is it's not been researched. We don't know that it's safe. And in the medical community, we are not recommending it.
Yeah, obviously, we're not here to promote or not promote any specific brand. We're really just talking about Zyns. And then when it comes to young kids and to weight loss, you talked about Ozempic, and we've talked about that before. You're saying that the studies for Ozempic show, okay, this can be safely used as a weight loss, and this, no.
That is correct. With the studies that are led by the FDA, these medications such as Ozempic, Wegovy are FDA approved, and they've been researched and determined to be safe, where the benefits outweigh the risk, but they have to be prescribed by a medical provider that's licensed in that state. And what the medical provider will do in the case of the FDA approved medicine is make sure that the person is a safe candidate for the medicine, monitor the person, and make sure that they don't have side effects that would warrant that that person does not tolerate the medication. But with the Zen, you just go to the gas station and you pick it up and you use it how you want. It's not monitored. We don't know if it's safe. And we want to encourage everybody that it's probably not the best option.
Yeah, my final question is this kind of feels like and sounds like when cigarettes were used as kind of a weight loss thing, and people thought that cigarettes were going to help us weight loss. And you would say, well, yeah, but the problems is that what cigarettes are going to do to you beyond what maybe losing 5 to 10 pounds would do. Is that similar, or am I kind of off base there?
Exactly. It's all about risk and benefits. The risk of cigarettes are much greater because we know that cigarettes can cause all types of cancer, cardiovascular disease, to include heart attacks and strokes. The benefit of losing 5 to 10 pounds do not outweigh the risk. But the problem with Zen is the research has not been done. We don't know if the benefits versus the risk. We don't know the risk right now. And right now they're associating different types of gum disease, periodontal disease, possible addiction, cardiovascular disease. Right now, everything is unknown. But what we want to do is we want to encourage people to always go with the safest route, which they deserve.
Dr. Quinn, thank you so much. And the next time I see you, I'll actually be at the studio and you'll be at work and we'll be back to normal.
Yes, sir. I hope you're enjoying that beautiful California sun.
Yeah, I'll see everyone on Thursday. All right, Dr. Quinn, thank you.
Yes, sir.